Hi, my name is Jessica Clark from 4400 Population Health. This is a presentation on environmental and cultural factors on the vulnerable population with eating disorders. As a recap from health concerns, people with eating disorders have extreme disturbances in their thoughts and eating patterns. There are three main types of eating disorders: binge eating disorder, anorexia nervosa, and bulimia nervosa. This population is vulnerable for increased health disparity in many areas. There are multiple health complications that affect every organ system in the body. With these disorders, other complications present, such as psychiatric conditions like anxiety, panic obsessive compulsive disorder, drug and alcohol abuse. The media often falsely portrays anorexia nervosa as a disorder associated with starvation and weight loss that affects young, thin Caucasian females who are from an upper middle class background who strive for perfection. The media also glamorizes thin body types as desirous, and exposure to the thin ideal in the media has a negative impact on various markers of health, ranging from lowered self-esteem, worsening of mood, and increased accessibility of negative thoughts to increasing eating disorder risk factors, such as body dissatisfaction, unhealthy dieting behavior, disordered eating behaviors, internalization of the thin ideal for beauty. Eating disorders are serious mental health disorders that result in the need to gain a self of control. They are more than an obsession with food and weight loss, but are characterized by underlying triggers that are associated with depression, self-harm, trauma, interpersonal conflicts, substance abuse, low self-esteem, and anxiety. The role family support plays in health outcomes is positive when the right approach is taken. Family-based treatment is effective in this scenario as an effort to keep patients out of higher levels of care. Decisions about eating are temporarily taken out of their hands and given to the parents. Parents have responsibility for deciding what their child eats and how much is eaten, when it is eaten, monitoring all food intake, and generally curtailing physical activity. Much like the treatment a team would do on inpatient unit, this allows patients to recover in their day-to-day environment with the support of their family and their support system around them. This can include regular family meals at home. This allows siblings to be supportive. It can reduce shame and secrecy. And parents can be an example of a healthy relationship with food. They can help build self-esteem by showing children they are loved and valued unconditionally. They can encourage critical thinking when social media peer pressure send mixed messages about self-worth. Teach them to question the message instead of believing it. We can teach children about good relationships with difficulties when they arise. Instead of focusing on numbing painful experiences, they can be taught how to deal with difficult feelings. Parents can be aware of warning signs. They can limit screen time to help with the exposure to social media and images. They can advocate for positive body talk. And people with eating disorders tend to stop believing that recovery is possible. So family and friends that support and believe in them can be a source of strength. Peers can play a negative and positive role. Up to 40% of overweight girls and 37% of overweight boys were teased, which contributed to low self-worth and started problems with eating disorders. But peer support and mentoring is helpful. Providing information and early recognition, peers are able to recognize an eating disorder and can help get support sooner. They can offer emotional support, and they can share experiences that provide a sense of hope for recovery if they've been in the same position. There is a cyclic nature and genetic inheritance in people with eating disorders. There tends to be a preoccupation with body weight and shape, and they can be more vigilant and anxious about their body fat, letting their appearance affect their self-evaluations. This leads to an excessive concentration on weight loss to pathological behaviors like restrictive dieting. Dietary restriction may lead to underweight or compulsive overeating and compensatory behaviors, which in turn cause more preoccupation with body weight and shape, which leads to the excessive self-control and body anxiety, and the cycle repeats. When looking at genetics, it was found that 28 to 74% risk for eating disorders is through genetic inheritance. Remember, this is a mental disorder. Some laws and policies can help when a person with eating disorders needs treatment. First, you should encourage a loved one to seek treatment on their own, since an eating disorder can be fatal. Parents of minors can seek treatment for children. Governed under state law, and this varies from state to state, parents can obtain guardianship, which is medical guardianship. It gives you the legal authority to make decisions about a person's physical and psychological care. And then there's conservatorship, which gives you the authority to manage another person's finances. It can be useful in eating disorders to reduce access to funds that are fueling the disorders. For both of these, a judge must decide that a person isn't capable of making these decisions on their own. There's also a 72 emergency hold, which can be given if a person is deemed an immediate danger to themselves or others. This gives the hospital the order to hold and treat a person until a judge can evaluate the patient's status and what should happen next. There's also a lack of public health policies that prioritize mental health. There's a lack of care for those with limited resources. Overall, when a person knows their loved ones care for them and want to help them, they will seek help if they have access to it. Potential barriers that make the population more vulnerable are dietary guidelines that are tailored on reducing obesity as a one-size-fits-all, cost of mental health services, time spent in session that requires money spent on childcare or missed work, policy and legal constraints such as restrictions on which conditions are reimbursed, mental health literacy, culture and ethnic influences, denial of the illness, less access to service, and stigma, which lowers the person's self-esteem enough to stop them from seeking treatment. Eating disorders take place globally. 9% of the population will have an eating disorder at some point in their life. Social media and technological advances have allowed adolescents easy access to images that affect their self-images. Mental health danger. Eating disorders are the second deadliest mental health disease. This population is at risk for withdrawal, bullying, substance abuse, physical and sexual abuse, as well as isolation and suicide. Socioeconomic status has shifted from wealthy white women to everyone. Symptoms of eating disorders are distributed equally across levels of socioeconomic status. For those that are unemployed, these psychosocial disorders make it difficult to work and maintain a job. Lack of resources without proper insurance and funding programs in rural areas, and to those of low income for mental health, people with eating disorders have a lack of resources. Eating disorders occur in all ethnic and racial groups. There's a higher prevalence of binge eating in all minority groups. Asian, Black, Hispanic, and Caucasian youth all reported attempting to lose weight at similar rates. Minorities, however, can be overlooked and underdiagnosed inadvertently. Evidence has shown that those with a strong, secure relationship with God experience lower levels of disordered eating, psychopathy, and body image concern. But alternatively, a superficial relationship with God without depth and meaning has shown greater levels of disordered eating, psychopathy, and body image concern. It was shown that veiled women have a more positive body image than Christian women, and the acknowledgement of a higher power is used in the 12-step recovery program for Eating Disorders Anonymous. For years, the focus of eating disorders has been on women. This has led to an inadvertent oversight of diagnosis of men, and it has made it so that men are less likely to seek treatment. But when they do, men are more likely to benefit from treatment long term. Transgender college students have 4 times higher rates of eating disorders. 32% of transgender people report using their eating disorder to modify their body without hormones. Gender dysmorphia and gender dissatisfaction in transgender people is often cited as a key link to eating disorders. There are rural areas that don't have access to inpatient treatment facilities, and transportation can be difficult to obtain. Lack of resources, facilities, and providers can be a disparity in rural areas. Telehealth is beneficial for mental health check-ins and appointments, and parents, as we mentioned above or before, can be trained to help with meal planning and creating a loving environment when in-treatment facilities are not available. Eating Disorders Anonymous has a Zoom meeting that's available for people in recovery multiple times every day of the week. And there's eatingdisordersanonymous.org and a contact helpline 1-800-931-2237. Some of the implicit biases of people with eating disorders are recovery is impossible, minorities are underdiagnosed, it's okay to be a little underweight, it only happens with young people, when in reality, eating disorders can develop at any age. Thin disease. People with eating disorders have all shapes and sizes. Thinking it's a thin disease adds to the anxiety. Gender. Men, women, and transsexual people all struggle with eating disorders. And some explicit biases happen when people blame parents for the eating disorder, including physicians. This mental illness has underlying causes that do not stem from the parents. And there tends to be the thought that the person doesn't have a problem and that they just need to eat. Many people will tell people with eating disorders that they just need to eat, not recognizing that mental illnesses prevent them from being able to eat. Eating disorders and mental health issues are a global concern. With the emergence of social media, doubt and anxiety about body image is global. 9% of the population will have an eating disorder at some point in their life.